Hi, Dr. Tania.
Hello.
Thanks so much for chatting to us today about the nasal flu spray for children. We thought it would be really important to talk about why that's effective for children, because we
Yeah.
know that this year there's probably likely to be more chance of people getting the flu because there wasn't much mixing during the pandemic, and all of our children are back at school and mixing. So, can you please tell us how we can protect our children from flu?
Yeah. So the best way to protect yourself from flu or protect our children from flu is to get vaccinated. And the reason it's important is, obviously because of the pandemic, like you said, there hasn't been that much mixing happening. And thankfully in children, you don't they don't generally tend to get unwell from COVID-19, but children do become quite unwell with flu. And particularly very young children under the age of 6 months, it can be a significant illness for them. So being vaccinated helps overall with that.
So, who is eligible for the nasal spray
O-
vaccine?
Okay, so if you have a child between the age of 6 months to 2 years and they have a long-term condition, i.e., a lung condition such as chronic lung disease, then they can go get the vaccine from the GP. Otherwise, all children between the ages of 2 and 17 are eligible.
Fabulous. Okay, so I've heard that children are classed as super spreaders.
Hmm.
Can you just kind of explain why that is the case and maybe that's why we should consider getting our children vaccinated?
Okay. I mean, obviously, the vaccine itself, you have to think about the benefit for the child. And for the child themselves, it reduces their risk of any severe illness. But on top of that, yes, they are super spreaders. And what that means is because of the way that children are, you can't tell a 2-year-old to socially distance. They will be hugging and, playing with each other. And when that happens, obviously, the virus will spread more quickly. And what happens is for, say, very young children under the age of 6 months, or those who are immunocompromised, so they can't fight off infections as easily, or the elderly, they are already at higher risk of getting flu. So vaccinating your child against flu reduces the risk of them passing on that virus to someone who perhaps is a bit more vulnerable.
And how effective is the vaccine? So, for instance, I remember taking my son and he sneezed straight after he had the nasal spray. So, sorry, it's a bit of a silly question, but would it still work?
Yeah, so yeah, it's completely normal for children to sneeze after it because if you put something up someone's nose, you're bound to sneeze. But yeah, so it doesn't matter if they sneeze after having the vaccination. If they have a runny nose, it will work just as well.
And what are the side effects for the flu nasal spray vaccine? What should we expect as parents afterwards?
Okay, so the majority of times, there aren't very many side effects at all, and if they are, they're very mild and they don't last very long. The main ones being maybe a runny or a blocked nose. Sometimes the child might feel a bit tired. They might lose their appetite a little bit, and some children do complain of headache. But like I said, they're very mild and don't last very long. If your child isn't eligible for the nasal vaccine or they need the injection instead, either because of their age or because of conditions that they have, then in that case, you might get a bit of a sore arm or a sore thigh, depending where the needle went in. They can get a bit of a raised temperature and they might complain of muscle aches. Obviously, a baby can't say that, but they'll just be a bit niggly. But again, those symptoms don't last more than a day or two, if that.
So, what's the difference then between those side effects and actually getting the flu? Is it not just the same?
No, it's not the same. So a lot of people say that it's very common, anecdotally, they say, "Oh, I got the flu after having it." It could be a couple of things. One is it takes 2 weeks for the immunity to build up, and if the child gets flu in the meantime, there's not much we can do about that. Okay. The other thing as well is, the flu vaccine is very effective, but none of these vaccines are 100%, and they may have got the flu, or they might have got another viral infection which looks like the flu, but it isn't.
So, before I do let you go, then, can we just
Hmm.
clarify actually how children do get the flu vaccines? You said earlier from 6 months to two, if they've got a long term condition, they might have to go to their GP practice. But
Hmm.
I'm aware that a lot can get it through their school as well. And
Yes.
2 to 3 year olds, can they get it as well as?
Yeah, so what happens is if they are between the age of 6 months and 2 years, then you should go and they have an underlying condition, a long-term condition, then you should go and speak to your GP and they will provide the flu vaccine that way. For those who are between 2 and 3 years old, you can get it from your GP as well. And then after that, any child in primary school or in secondary school will get it through their schools.
And you've got a 3 year old, haven't you? And a
Yes.
newborn. So
Yeah.
will your 3 year old be getting the flu nasal spray?
Yes, yes. I mean, she's three. She had it last year, and she will be getting it this year at some point when I can get around to doing it. And primarily for her benefit. So hopefully she doesn't become too unwell over winter, but also, because most people have one child and then everyone comes along. So it's usually a good idea, in terms of my son as well, it would be a good idea to protect him as well, that way as well.
Thank you so much for your time today.
No problem.
And for anybody else wanting to know more information about the flu nasal spray or the vaccine for your child, you can visit the website and the details are on the screen now. Thank you.